this
Okay,
time.
that sounds good.
Rolling.
Okay,
What's your name?
I'm Patrick Moore, and I'm teaching this class on melting muscles. I've sort of stumbled upon these theories that work really well, so I'm teaching it and publishing all kinds of stuff about it. And basically the theory is if you put muscles into a shorter position like the biceps, let's say that this person's having trouble with their biceps, pain there, and I want to come and do something with it. If I make the biceps longer and kind of stretch it and try to make it soften that way, I'm using force. And but because the muscle's tight, her brain is telling the muscle tighten up. And so what I do is I come up and I make the muscle. Oh, did you see it twitch just there? I put the muscle in a shortened position, and the brain likes that better because it's exactly like what it wants to do when it's guarding. And so just holding a muscle in its shortened position will get it releasing pretty quickly. And then if at the same time I come up to the muscle and I'm doing a little bit of work here, just kind of finding the fibers and pressing lightly. How is that hard?
No, it's very light.
Very light. And then, can I feel it yet? Okay, now it's starting to soften just ever so gradually. And as it's softening, I'm feeling her arms starting to want to lengthen again. And it's, I don't know if you can see this, but ever so slowly the arm is coming back into a straightened position. So melting muscles is a combination of the one hand doing this, where I'm sensing what her brain is telling the muscle to do, and the other hand doing this, where I'm palpating the muscle and helping it to feel relaxed. So I'm sending sensations back to her hindbrain. We're like having this nonverbal conversation going on as we're doing this. I'm having two conversations at once, one over here and one back here with her hindbrain. And there's twitching. Did you feel that twitch again? So you can do this with pretty much any muscle in the body. Do you have any muscles that are bothering you right now?
Mostly in my mid-back.
Your mid-back, like between your shoulder blades?
Correct.
So what can we do for this? Looks like your two shoulders are about evenly high. Like right around in there?
Even a little bit lower.
A little bit lower? Okay, so it's on one side or the other?
Both of them.
Both of them? Okay, I'll just start with this side. And I'm going to work on her lower trapezius, which lowers her shoulder blade. So I'm actually just going to put some weight on there so it's even lower than it normally is, which would put the lower trapezius, which goes from here to here, now it's a little bit shorter than it normally would be. And then I'm going to palpate it. Okay, right there it is. Does that feel like a good spot? Is that like the spot you were telling me about?
Pretty close.
Okay.
There it is.
Oh, there it is, okay. You feel it softening already?
Not quite yet.
I feel it melting. It's melting like crazy. It's also kind of pulsing. It's going to be gone pretty soon. You don't feel it melting?
I felt a little bit of a pulse.
Okay, but you don't feel the kind of softening.
Not yet, no, unfortunately. I wish I could.
What does it feel like to you?
Just pressure, but not uncomfortable.
Okay.
There's a little bit more, that's more of like a trigger spot that I felt before in
Okay.
that lower, yeah.
I'm taking my pressure off the shoulder and letting it kind of come back up into a normal position.
Sensitive in that right there.
Okay, I'm kind of bringing your shoulder blade back more now, so it's getting shortened again. And back forward. Do you feel it softening? Good.
It's much less
Yeah.
sensitivity.
Yep, it's definitely melting away. We're having some melting muscles right now. Does it feel different?
Very much, yes. So I can, when I do this, it's not as stiff or like it would pull. You could feel right in that particular area where it kind of was like tugging, and so it doesn't have that tugging sensation.
Awesome.
It's great.
Thank you.
It's wonderful. Thank you.
All right.